So today we're looking at tackling the lines above the lip, the perioral lines, also known as smoker's lines. And whether you've smoked or not, quite often as we age, they can appear. They're tricky to get rid of, but easy to soften. And for the purposes of this treatment today, we'll be using a product called Hydromax, made by Vivacy. It's part of the Stillage range. It contains 12.5 milligrams of hyaluronic acid, is very lightly cross-linked, so it doesn't have the same properties as an obvious dermal filler, but will help to spark a healing response of the skin cells in the deep dermis, and as they penetrate through during the skin cell cycle, the epidermis will appear repaired and the lines will be softened. So this treatment can be done with a needle or a cannula. It's helpful to cross over the vertical lines horizontally with small linear threads. For the purposes of today, we're going to use a needle. You do need to let your patient know that they can bruise because it is a very vascular area of anatomy. So it's just a very small injection into the deep dermis. Now, if you push your needle down, you'll know you're in the deep dermis because it tugs the skin. And if you pull it up, you'll see the outline of the needle or the cannula. And it's just small linear threads. And we repeat that so it cross hatches along the vertical lines of the perioral region. It's a very forgiving product if it's in the right layer of tissue. If you do place it too superficially, it will leave your patient feeling a little bit lumpy and bumpy for a few weeks. So just be mindful of that. So you can see the tug on the skin along the needle and just a smooth linear thread. And if you just massage that, you'll feel it's a bit like honey. It spreads out really nice and evenly. Feel okay? And we just repeat that further along the upper lip in very small linear threads. It's a really basic technique, limited risks and side effects, but your patient can bruise. And we do exactly the same on the other side. So check for your creases. And we'll come in horizontally into the deep dermis across those lines. Half a mil is usually enough to begin with, and then you can bring your patient back in 2 to 4 weeks when the results are nearing their optimum, in line with the skin cell cycle, because your skin cell cycle is roughly somewhere between 28 and 38 days, at which point this will be looking a lot softer. You can also use Hydromax in the lip line if you just rest your mouth open for me. So for patients that don't want an obvious result from lip filler, but would like a softening of the perioral lines that track onto the upper lip, if you keep just under the vermilion border, little scratch, and place within the vermilion border very small linear threads of dermal filler or Hydromax in this case, you'll get a very subtle softening of the lines without an obvious ledge of lip filler, which for your more mature clients is a really nice result. You all right? Is it really painful?
No.
Little scratch? Yeah, a bit nippy. It's really hydrating as well, so it's a nice treatment for anybody with really dry lips that suffer from chapped lips through the summer, the winter. They don't want lip filler, but they just want a treatment to enhance the hydration. It's very, very useful. It's a little scratch. And a little scratch. And we'll place a little bit along the bottom lip as well, just to even textures. So rest your mouth open for me. Thank you very much. Little scratch, a bit nasty. Well done. Just be mindful of the anatomy in this area. Although it's lightly cross-linked, there is still the potential to cause a complication. So prior to treatment, have a little look inside of the mouth and check for the blood vessels in that area. And then just use a little bit of arnica cream or Emla cream, Vaseline, whatever you've got in your toolbox, and give it a light massage. So you'll find it doesn't need massaging as vigorously as dermal filler. It's really forgiving, but just lightly blend it into the borders so there's no disjointment from linear thread to linear thread. And then in addition to the Hydra Max, we're going to use a dermal filler that's slightly heavier cross-linked just to soften these lines around the mouth and lift the corners of the mouth. So for the purposes of this, we're using Stillage M, and this again is made by Vivacy. Rest your mouth open for me. So if you get your patient to rest their mouth open and you want to just come under the oral commissure at this side, you're picking up into the subcutaneous tissue and then just under the vermilion border, a couple of little threads. So you'll see where my needle is here, and it's just a swoop of dermal filler to lift that up. If you open really wide for me, you can also place just under the crease of the corner of the mouth 2 little boluses and give them a little massage, and this helps to support the downturn that comes with aging. And relax. So you'll see that's beginning to lift. And then using something more structured like M, you can visit the philtrum columns. Bear in mind, philtrum columns are a sign of youthfulness, but you want to make it age appropriate to your patient. So don't overfill them. A little scratch, this will be a little bit nasty. So in a more mature patient, if you just come above the cupid's bow and not in from the lip tissue, straight up the philtrum, there is an artery here, columella artery. So please feel free to aspirate if that gives you some reassurance in your practice. Same again. So sorry. And that just replaces the structure that's lost in the upper lip tissue. Helps to enhance the cupid's bow as well. Just do a touch more at this side. Are you all right? You're done, that's all your injections finished.
Thank you.
feel a bit painful while I massage it. Just need to make sure it's not lumpy or bumpy. Just get inside your mouth, please. Thank you. Thank you. So whenever we do a lip treatment or any treatment around the mouth, it's important to check afterwards your capillary refill time on the outer tissue to ensure you've not caused any vessel occlusion, but also on the inside of the mouth. So pull your patient's lip downwards, make sure your filler's not sat too superficially inside, and the same at the top. And when we've treated the philtrums, we're at risk of blocking the columellar artery, so just check the roof of the mouth as well. And that all looks great.